Well, I know that we kind of talked a little bit on the birth of, you know, a child, but I kind of want to back up even a little bit more during the pregnancy. And, you know, we also have a lot of women during their pregnancy, they have a lot of back issues, you know, carrying the extra weight and such. So I just kind of know about how chiropractic care could even comfort a pregnant woman. And, you know, if someone's out there and they're in chronic pain, how could you benefit that person?
Sure, absolutely. I do work with quite a few pregnant women, and they get great results. And the reason that is oftentimes as a woman's pregnant, as the belly starts to grow and the baby starts to grow, her center of gravity starts to shift forward. We have more weight coming forward, and so she has to kind of counteract that by bringing more weight backwards. And so this shifts everything, and it puts more stress and pressure onto the lower joints through the pelvis, the hips, and the sacrum, and that can often lead to things like low back pain, or maybe leg pain, or maybe, you know, the baby's kind of sitting maybe where he shouldn't be, and it makes mom uncomfortable. But it also helps moms just maybe sleep better and have more energy, because as we work with the nerve system and we fine-tune the spine, get it properly functioning, we remove that interference, mom functions better. And when mom functions better, baby functions better, and they both benefit, and they can sleep better and have more energy. So it leads to a much more enjoyable pregnancy for a lot of women, and a much safer delivery. Actually,
very much so, yes.
Chiropractic has been shown in numerous studies to lead to better births and better deliveries. It has a much increased chance of having the baby being in the right position for birth, in a different technique that I do called the Webster technique. So the benefits really are far-reaching from the pregnancy to the delivery for both mom and the baby.
Well, that sounds great.
Yeah.
Well, you just mentioned the Webster technique, and I'm not familiar with that, and I don't know if many of my viewers are either, but I'd really like for you to elaborate on that if you could.
Yeah. The Webster technique is a technique I've been certified in through, again, the ICPA. And
that
it's
means?
the International Chiropractic Pediatric Association. And we are specifically taught how to analyze the spine, and it's very specific chiropractic technique where we analyze the spine, lower spine, pelvis, the sacrum, which is where your tailbone attaches, and we look for any restraint, any misalignments, or any interference to the nerves that come out of those areas. If we locate those with very specific adjustments and techniques, we can free those up, allow the body to move better, therefore freeing up any nerve interference. So then again, the body functions better. This then can remove any tension to the muscles in the pelvis and to the ligaments, and it has been shown to remove what we call intrauterine constraint, where the uterus is just kind of constrained from all the tension. So as it removes that, then the baby is oftentimes allowed to get in the best possible position it can, because there's no more constraint on them.
And then the baby can grow and be healthy.
Yes, absolutely. And then the baby can get in that great position. We hope it's head down, but the baby can move how it can. And then the baby's allowed more room to grow and to kind of go through the rest of the pregnancy, hopefully. So, yeah.
And, you know, that just seems so beneficial to have a natural birth instead of an emergency C-section, you know, for the outcome of both the mom and the baby.
Absolutely. C-sections are really on the rise in this country, and there's a lot of different reasons why. And so if a mom really wants a natural birth, a lot of what we do is educate on what maybe could be some reasons, and what are some things we can do with your adjustments, with your posture, with exercise and strengthening and all that stuff to help give you the best chance possible to have that normal, natural birth that you want. So,
What a great outcome for, you know.
It is, for both mom and baby and everybody involved. It really is.
The whole family,
Yes, absolutely.
Well, that sounds so great. I know that Woodwinds Hospital is now talking about the healing touch. They are expanding a little bit more, and now with this.
They've got chiropractors there, they have doulas, and they're really bringing in this great realm that moms now have access to, which I think is phenomenal. That's such a great resource that they can have.
And what a great step in the right direction. To focus basically on the patient and let them make choices.
Exactly. And we have new birthing centers here, 2 new birthing centers in the Twin Cities, which is another really great reference, whether you want to have, it's an in-between between a home birth and a hospital birth. A very natural setting that is now an option for women that is a phenomenal option now, and we've got 2 of them. So we're very unique and excited to have those both here.
Yeah. So. I mean, we have just advanced so far in birth.
Oh, we have.
You know, even when the last 25 years when, you know, the father wasn't invited in, and now we have everyone come in, whoever they want.
Yeah.
You know, and it's at their discretion.
Exactly. Yeah.
So I just love it, because I know when I'm not feeling well or if I'm in pain, I like to be surrounded by my loved ones. Yeah.
Absolutely. And a lot of women want the same thing when they're giving birth. They want a comfortable place to be that maybe isn't so sterile like a hospital could be, and they have so many different options available to them now that it's great. It's so unique.
Yeah. And to individualize it like that, to make choices. And
absolutely.
Wow. To just step away from, you know, the actual pediatric care, I know that you also are specialty in athletics. So you also work a lot with athletes.
I haven't finished my specialized training yet, so my main kind of another focus I have is in athletic care, and I've done other classes to focus on that too. And I've seen a lot of runners, a lot of hamstring injuries where they just weren't getting better, and they wanted to get out and do what they wanted to do. And I've just seen their amazing results. And with athletes, they tend to also maybe respond faster because their bodies are so well tuned, and they're so well tuned into their bodies and how they respond. And so their chiropractic care is very, very beneficial with getting them back to that peak level of performance that they're looking for, and getting them back out to running or whatever their sport may be.
Sure.
It helps them rebound faster from an injury, and hopefully maybe prevent some of those injuries by promoting that overall balance in the body, and helping the muscles stay balanced, and the bones and the joints and the spine stay in balance.
Yeah. So they almost come to you maybe even prior to?
Yeah. Yep, a lot of them do. A lot come prior to. A lot of athletes are really promoted to go to chiropractors along with their trainers and everything else that they're doing. So it's a really good collaborative approach amongst different health professionals. And then some will come after an injury, and then after they notice the benefit, we continue to work on them with wellness care and keeping them functioning at their best, along with maybe other things they're doing in their training, because their training can be really intense.
Oh, very
whether
much so,
you're
yes.
just a weekend runner or whether you are a serious marathon runner. Everybody from that whole entire realm needs to have their body functioning at their best, so their muscles stay healthy and they stay healthy.
Right. And I know a lot of people, you know, they want to be at the top of their game.
Exactly.
You know, because some even actually get paid to play.
Exactly, exactly. And we get very competitive. We all want to win, so absolutely.
And to know that you're, you know, the best you can be, so you can go out and give 110%.
Yep, absolutely.
Yeah.
I was looking at some stats the other day. Approximately about 30% of the the NFL teams use chiropractic. So a lot of our football players, golfers, tennis players, a lot of our professional teams are starting to have chiropractors on staff.
Oh,
there are a number of chiropractors around the Twin Cities that treat and help a lot of different athletes also with their care. So it's definitely on the rise and getting a lot more popular.
Yeah.
So.
And I like that idea. They have a medical doctor in case one of them, you know,
absolutely
has a concussion or, you know, something.
Absolutely.
Physically.
They can handle the emergency situations, and maybe they'll have a trainer to help them train and get the most out of their performance. And then we have a chiropractor that keeps the spine in line, keeps the body functioning well. And when you have that collaboration of effort, the athlete tends to get the best of everything, really, of what everybody has to offer. So, yeah.
And that's just a great way to show that you care about that team player.
Exactly.
You know, by having such great staff on hand.
Yeah, absolutely.
Yeah, that's great.
Yeah.
Now, I'm not sure a lot of people know a lot about your office in Maplewood, but I know that you have a unique office, you know, because you actually educate a lot of people that come.
We do. This is what we've been told, is we have a pretty unique office.
Yeah.
I'm located in Maplewood, just kind of down Highway 61, and we've gotten people that have maybe come from and had chiropractic in the past, or maybe have never had it before. And from their experience from when they first walked in, it's a very welcoming, a very warm place to come.